Now with a segment on research studying medications for breast cancer prevention. Here's our reporter, Laura Windsor.
STAR Trials is the second prevention trial for breast cancer that has been studied on a national level. These trials determine the effectiveness of certain medications in preventing breast cancer. Dr. Janet Eide of Desert Regional Medical Center in Palm Springs discusses the medications currently being studied.
STAR trial is the study of tamoxifen and raloxifene. In other words, it's comparing two medications to see which one might be more advantageous to prevent breast cancer. They noticed retrospectively, or looking back on a population of women who had osteoporosis and who were being treated with raloxifene, that they had less breast cancers. And that stimulated researchers to look at that as a potential drug for prevention of breast cancer. The first prevention trial, or P1, was published in the late 1990s and proved that tamoxifen can decrease a woman's risk of breast cancer by as much as 50%. These are patients who carry a high risk of getting breast cancer. This stimulated the study of the P2 trial. The P2 trial is looking at comparing tamoxifen with another medication called raloxifene. Many people know it as Avista, to see if one may have the one advantage over the other as far as prevention is concerned and as far as side effects are concerned. The first part of the P2 study has been published, and it looks like both are equally protective in high-risk women with breast cancer who do not have in situ breast cancer and who are postmenopausal. However, raloxifene definitely has fewer side effects. It has 40% less uterine cancers associated with it and a 30% risk in reduction of deep vein thrombosis and pulmonary embolism. We're the only center in the Coachella Valley that is sponsoring the program. I'm the principal investigator of the P2 trial. We've accrued, which means accumulated, approximately 30 patients onto the trial. In fact, half of them are still on the trial, and half of them have already completed the trial or have gone out 5 years. So I have a whole group of patients that I follow every 6 months in my office with blood tests and examinations. They're locked into very close follow-up to see what their risk, how their risk is going in developing breast cancer, which ones are getting it, which ones have not gotten it yet. Both of these treatments are for 5 years total, hoping that it will continue to provide a protection for another 5 years, but the medications are not given for more than 5 years. Many patients who are put on the P2 trial are already very concerned, or what we call cancer phobic. They're very concerned about getting breast cancer. These are women who have had a very strong family history, which means a first-degree relative with breast cancer. They've had, for example, a biopsy that has shown a high-risk type of tissue, which makes them concerned that they're going to develop breast cancer. It also has to do with the patients who have not had children. Those who have not had children are at higher risk, or those who have had children at a later age are at a little higher risk. This has to do with the age of when women go through menopause. So it's a whole series of questions that we ask. We do a risk profile on them to see what kind of risk they have of getting breast cancer. We offer the trial to those who have approximately 1.7% chance of getting breast cancer in the next 5 years. That's considered high risk. Those women are then interviewed and fully informed about the risk and benefits of the trial, and some go on it, some don't. Hopefully, we'll have even better agents on the market that women can take by mouth to prevent them from getting breast cancer, prevent the mutation from occurring that causes breast cancer.
Research is ongoing to develop better ways to detect and treat cancers, and cancer prevention is on the forefront of these studies. I'm Laura Windsor for the American Health Journal.